next topic is planes of section. We can divide your body into different planes of section. Okay, so basically we can cut your body in a couple of different ways, and that could be a literal cutting, we could do a surgery, or it could just be a figure of speech cutting. Okay, so we have three main examples: sagittal planes, frontal planes, and transverse planes. Sagittal planes, we can cut your body into left and right sections. Okay, now we could do this directly down the middle of your body and end up with a mid-sagittal plane. We would get equal left and right portions. Okay, so literally down the middle of your head, through your nose, your mouth, right down to the bottom, we'd split you in equal lefts and rights. Now, if we cut you sagittally, but we do not get equal lefts and rights, this is called a parasagittal plane. Okay. We could cut you instead into a frontal plane. Okay, sometimes it's termed a coronal plane. When we cut you this way, you end up with an anterior and a posterior section, or a front and back section. Okay. Last but not least, we could cut you in a transverse plane. It's also referred to sometimes as a horizontal plane. When we cut you this way, you end up with superior and inferior sections if we're cutting you, in your midsection, something like that. Or you could say you end up with a proximal and distal section, depending on, if you're now in an arm or a leg region. So basically, we're getting a top and a bottom instead, if you want to think about it that way. So we've got some picture examples. So here we go. We've got our sagittal or our parasagittal. We are cutting down the middle. You see we have a right side and we have a left side. So this brain scan shows us that sagittal section, or that mid-sagittal section. Okay. Our frontal plane instead, again, this time we end up with a front section or an anterior. Okay. Or a ventral section, and then back here it's a little harder to see, you would end up with a dorsal or a posterior, a back section. Okay, you'll notice that our image is quite different this time. Okay, last but not least, our transverse section, we said we're going to end up with more of a top and a bottom, or to use our science terms, a superior and inferior, or a proximal and distal section. And again, you'll notice that our picture here for a third time looks completely different. Okay? So all of these different planes of section have different purposes for diagnostic reasons in a medical setting. Okay, you get to see different things. Alright, so quick practice. Take a second. Pause your video, look at these three images real quick and figure out, we've got one example of each. Okay, go ahead and pause, figure out which one's which. When you're ready, restart your video. Let's double check your work real quick. Alright, so you've made your educated guesses. Let's verify your work. So this section right here, or this view, would be a sagittal section. Okay, so you can see a full spinal cord, you can see pelvis, things like that. So this is taken from somebody's side, okay, from their right side. Our middle picture would be a transverse section. So this outline, okay, is a thoracic cavity. So perhaps we've cut you through the diaphragm, and now we're looking into your body. So this little triangle is your vertebral column, or your vertebral bones, your lower vertebral column, and then you've got your arteries, your veins, things like that. So this would be your thoracic cavity. And so last but not least, we've got your frontal plane. So this is the front of your body. Okay, you can see your liver, some of your other organs, your hip bones, things like that. So we're looking at the front of this person's body. Okay. You've got a few more practice questions. Take a second, pause your video, do these on your own. When you've done these 4 questions, restart your video. Let's check your work. Okay, you've done your own work. Let's check your geniusness. Okay, so this type of body plane divides you into lefts and rights. That would be a sagittal section. This type of plane divides you into equal lefts and rights. That would be mid-sagittal. This plane divides you superior and inferior portions. That would be transverse or horizontal. And this one divides you into anterior and posterior. That would be a frontal or a coronal plane. Our three images down here, we've got a sagittal, or if you said that was mid-sagittal, that'd be fine as well. This guy would be a frontal or a coronal section, and our last guy would then be a transverse or horizontal section. Okay? Alright, some more practice questions to really make sure we are mastering these topics. Pause your video, do these on your own. When you're ready, come back, let's check your work. Alright, number 1, to scan an image of the brain from the anterior to the posterior, we would need a frontal or a coronal plane. To make an incision that transversely divides one of your vertebrae from the next, okay, we would be making superior and inferior portions. Ron has diabetes, had to have his left leg amputated below the knee. The surgeon needed to make a transverse or a horizontal cut to remove the lower portion of his leg. To cut off your nose in spite of your face, okay, if we were to cut off your nose, we would need to use a frontal or a coronal plane. Van Gogh was an artist. He did cut off his own ear. In order to do that, he needed a sagittal section, or if you wrote parasagittal, since it would be non-equal lefts and rights, that would have been appropriate as well. And last but not least, the diaphragm rests beneath the lungs. It makes a natural transverse or horizontal plane between your thoracic and your abdominal pelvic cavities. Alright, speaking of cavities, okay, you do have fluid-filled spaces in your body. Okay, they're meant to help you protect your internal organs. They move and expand as we breathe and digest, things like that. And we have two main categories, dorsal cavities and ventral cavities, and then we further subdivide. So your dorsal body cavity, okay, dorsal or posterior, anything on the back side, okay. We have two subcategories. You've got your cranial cavity, it includes your skull, which protects your big old brain, and then your vertebral cavity, or if you want to refer to it as your spinal cavity. This is where your vertebral column lives, and it protects your spinal cord. So we said that these are fluid-filled cavities, so our fluid here is cerebrospinal fluid. Okay, helps protect your brain and spinal cord. And then we have our, I'll make sure I didn't skip anything. Then we have our ventral body cavity, so the front side of our body. We have two subdivisions here, your thoracic cavity and then your abdominal pelvic cavity. Our natural division here is the diaphragm. Okay, so your thoracic cavity is your superior cavity, while your abdominal pelvic cavity would be the more inferior body cavity. Now the thoracic cavity, we can further subdivide just a little bit more. We have your pleural cavity, your mediastinum, and your pericardial cavity. Now your pleural cavities are going to surround each one of your lungs. So you have a left one and a right one. Okay. Your pericardial cavities surround your heart. Okay. You only have one heart, so you only get one of those. And then you have your mediastinum. Okay, now your mediastinum is a little different. Okay, it sits between your pleural cavities, or between your lungs. It includes your heart. Okay, but it also includes the vessels that come off your heart. We call them great vessels. So your aorta, your vena cava, etc. It also includes your trachea, or your windpipe, and your esophagus. Now, what's the difference here? Okay, so your mediastinum, in addition to just having more things than just the heart, okay, it's not lined with a serous membrane, but your pericardial cavity is lined with a serous membrane. Okay, so that's a pretty big difference as well, and we're going to come back to serous membranes here in just a few slides. Okay, so just kind of make yourself a little note there. Now the abdominal pelvic cavity, we can further subdivide into just the abdominal cavity, which goes from your diaphragm to your bony pelvis. Anything below your bony pelvis is now just your pelvic cavity. Okay, so you've got your digestive organs, you've got lymphatic organs, reproductive, urinary organs, all that kind of good stuff. And these are all housed within the peritoneal cavity. Okay, this is another serous membrane that lines many of your organs within your abdominopelvic cavity. Okay, so again, another serous membrane. Put you a little note. Okay, so you already know there's a lot of stuff that goes on inside your abdominopelvic cavity just because you have so many organs there. Okay, so when we do diagnostics, when you go in complaining of, belly pains, things like that, your doctor needs to narrow it down a little bit more so we can divide you into quadrants. You have a right upper quadrant, right lower quadrant, left upper and left lower quadrants. But you will notice, if we kind of look behind the words, we still can have quite a lot going on in each one of these quadrants. So if we need to be a little bit more precise, we add a few extra regions. Okay, so now we can cut you up into 9 segments. These have some weird names to them. You need to know how to spell hypochondriacs. You might want to go ahead and practice that one. Okay, so we'll just go top to bottom. Okay, so we have a right and left hypochondriac on either side. Hypochondriac refers to below your cartilages of your ribs. So hypochondriac, hypo is below, chondriac refers to your cartilages of your ribs. So if you imagine behind all the organs, this would be right below your rib cage. Okay. Oops. Okay. In between your hypochondriac regions, you've got your epigastric region. Okay, so right on the midline, right underneath your diaphragm. Okay. Our next row, we have a right and a left lumbar region. Okay. These correlate to the lumbar vertebra in your back. These would also correlate, so if we wrap this around to this person's back, this would correlate to your lumbar region of your back. So a lot of times you'll hear people say, oh, I've got lower lumbar pain. So they're usually talking about their lower back region. In between your lumbar regions, you've got your umbilical region. Everybody knows your umbilical region. This is where your belly button is. Okay, everybody knows where your belly button is. And last but not least, we've got our right and left iliac regions. Okay, iliac refers to your ilium or your ilia of your pelvis, which is the top bone of your pelvis. Okay, and in between those, you've got your hypogastric region. So hypo, we said, meant below. Okay, gastric refers to your stomach. Okay, so this is below your stomach. Here's your stomach. We are in fact below your stomach. Okay. I don't think I said it, but epigastric refers to above, and then gastric is stomach. So here is your stomach. We're right above your stomach. Okay. So maybe those terms can help you remember those as well. Again, do not be surprised if you're asked to label one or more of these regions on your quizzes and on your exam. Okay. Alright, a little bit more practice. Go ahead, pause your video, fill these in on your own, and then let's check your geniusness. Alright, so let's check your geniusness. Your thoracic cavity contains your heart and your lungs. Okay. The blank, your breathing muscle, that would be your good old diaphragm. Alright. The middle area of the thoracic cavity would be that mediastinum that we mentioned. Your lungs are housed in your pleural cavity, while your heart is in your pericardial cavity. Okay. The blank cavity contains your GI system, that would be your abdominal cavity, and then your pelvic cavity would contain your bladder. And then we've got our dorsal cavities. Cranial cavity houses your big old brain, while your spinal cavity houses your spinal cord. Okay, so hopefully those weren't too bad for you. All right, we keep mentioning serous membranes. Let's make sure we know what we're talking about. Okay, so we have 3 specific serous membranes that come up over and over and over when we talk about your heart, your lungs, and your abdominal cavity. Okay, so we've thrown these words around a couple of times. Let's make sure we know really what's going on. So your serous membranes are double-layered structures that surround these organs that we keep mentioning. Okay, so it's a double layer. We have a parietal layer and we have a visceral layer. Okay, and again, each one of these, your peritoneum, your pleura, and your pericardium, are going to have both of these layers. So you have a parietal peritoneum, you have a visceral peritoneum, a parietal pleura, and a visceral pleura, and a parietal pleura and parietal pericardium and a visceral pericardium. Okay, I'm going to get the words out, y'all. I'm going to get them out. So that parietal layer would be the first layer you come to if we're going superficial to deep. Okay, so if we're going down into your body, we would hit that parietal layer first. It touches your thoracic wall or it touches your abdominal wall. And then if we keep on going, we're going to come to some fluid. Okay, it could be pleural fluid, pericardial fluid, serous fluid, whatever you want to call it. And then if we keep going a little bit more, we finally hit that visceral layer. Okay, now that visceral layer touches the organ itself. So if we are, again, going down deep into your body, once you get past the visceral peritoneum, pericardium, whatever, then you would be touching the organ itself. Okay. Now, we do have some images that we can practice our quadrants and our segment terms with. So pause your video, take a second. Let's make sure that we can kind of do these from memory. If not, flip back a couple of slides. Let's make sure we get all these down. All right, pause your video. When you're ready, come back and check your work. All right, here we go. Right upper, right lower, left lower. Okay. These really aren't hard. There's only 4. You have a right and a left. You have upper and lower. Spell quadrant correctly, please. Thank you. The 9 is where people get you. So let's make sure we are geniuses. Here we go. Right hypochondriac, epigastric, left hypochondriac. And then we move to our right lumbar, umbilical, left lumbar. Lastly, right iliac, hypogastric, and left iliac. Again, make sure you're practicing these. Print off blank images, get you a page protector and a dry erase marker, or some sticky notes, something like that. Just do a little bit of practice over and over and over. Alright, speaking of practice, here we go. Pause your video, do your own work, restart your video when you are ready to check your answers. Alright, here we go. Let's check our work. The umbilical region is blank to the epigastric region. Your umbilical region is inferior to your epigastric region. Left hypochondriac region is blank to the epigastric. That would be lateral. Your hypogastric region is blank to your epigastric. That would be inferior. Okay. Right iliac region is blank to the right hypochondriac. Would also be inferior. Thoracic cavity contains what organs? Your heart, your lungs. Okay. Diaphragm separates your thoracic from your abdominal or your abdominopelvic cavity. Your liver, your stomach, your pancreas, your intestines. All of those live in your abdominal cavity of the ventral body cavity. Okay. All right. Last but not least, got a picture of the serous membranes. I will fully admit that it can be a little difficult to tell which one is which in this image. Just do the best you can. Okay, we're just practicing. This one's pretty easy. Okay. We only have one answer here. Okay, but these four we're looking for ventral versus not ventral. We're looking for visceral versus parietal layers. Which one's your pericardials? Which one are your pleuras? Okay, take a second. Go back a couple of slides, review those terms, where they're located, all that. When you're ready, let's see if we got these correct. Alright, let's check our work. Okay. Now, again, this one was pretty easy. Okay, we didn't ask for parietal versus visceral peritoneum. We just collectively, this is your peritoneum, all this blue stuff. These, your viscerals, and your parietal pericardium and pleural membranes. Again, it's a little difficult to see them in this image, so if you struggled with this a little bit, don't be too hard on yourself. We do have a couple additional examples that we'll go over, some extra practice questions, things like that, give you some better images to continue your practicing, okay? Alright, that concludes our lecture on the intro to A&P, body regions, directional terms, body cavities, planes, membranes, all that good stuff.